The Saskatchewan College of Pharmacy Professionals Competency Assurance Program requirements are changing. This presentation will build on previous communications to discuss why the program is changing, what the new requirements will be, the timeline for implementation, and to address some frequently asked questions. First of all, we acknowledge that SCPP staff and members are treaty people, living on land covered by Treaties 2, 4, 5, 6, 8, and 10, which is the traditional land of the Cree, Dakota, Lakota, Dene, Nakota, and Saulteaux peoples, as well as the homeland of the Métis. It is important that we keep our treaty responsibilities in mind as we talk about what is needed to ensure quality healthcare is provided for all, as Indigenous communities continue to experience inequity in the Canadian healthcare system. By the end of this presentation, you should be able to identify the reasons that SCPP is revising our Competency Assurance Program, identify the goals of the revised Competency Assurance Program, list the requirements with the revised Competency Assurance Program in the coming year and future years, including identifying what documentation you'll be required to submit, and how to ensure topic requirements, such as the cultural safety requirement, are met. You should also be able to identify how SCPP plans to monitor and evaluate the program. The Competency Assurance Program is being revised to increase the ability of the program to impact patient care and public safety. The revised program is based on continuing professional development, which is a more robust way to maintain and improve pharmacy professional competency than using continuing education alone. CPD is expected to lead to better patient care and has been recommended by the International Pharmaceutical Federation as the basis for pharmacy professional continued competency since 2002. Having professionals document and submit CPD allows SCPP to see what areas of CPD pharmacy professionals are needing support with so that we can develop and personalize this support to the unique needs of Saskatchewan pharmacy professionals. Second, SCPP has a regulatory responsibility as a self-regulating profession to evaluate evidence that pharmacy professionals are completing CPD. This is based on both trusting pharmacy professionals to do what's best for their patients, but also the need to verify that pharmacy professionals are taking steps to maintain their competency and improve the quality of their practice. If you haven't had a chance to take a look at the Microscope newsletters from September 2022 and July of 2024, we recommend you do so for more information on the work done towards the revisions of the program to date. There is also background information presented on the SCPP website in the Competency Assurance Program pages, which can be found by scanning the QR code on this slide. The purpose of the Competency Assurance Program, therefore, is twofold. It is to ensure that professionals are engaged in continuous improvement throughout their careers to maintain and enhance competency, and to provide assurance to the people of Saskatchewan that pharmacy professionals are engaging in such a program, which helps reassure the public that quality care will be provided. The specific objectives of the program are to empower pharmacy professionals to engage in learning that is meaningful to their individual practice. That is, to make sure that you're able to complete and be credited for the professional development that is meaningful to you, whether you work in community, hospital, specialty practice, non-direct patient care practices, etc. We need evidence of this work as the regulator, but we want to make sure that we're valuing what matters to your practice. The Competency Assurance Program also aims to provide guidance for you to complete quality CPD, to improve how you're learning and developing, to make the best use of this time, and ensure that it is impactful on your practice. The Competency Assurance Program will include mechanisms for pharmacy professionals to collect and use feedback to guide continuous improvement of practice. It will include methods to verify, through annual verification of a portion of members, that pharmacy professionals are improving their competency and practice quality through CPD. The program will support competency development that is necessary for expanded scope of practice activities, including confirming the quality of these expanded scope activities in practice. And finally, the Competency Assurance program will proactively address competency risks by providing individualized intervention and support to those who would benefit. In 2019, SCPP Council, which is composed of pharmacists and pharmacy technicians in Saskatchewan, set a strategic plan goal for 2020 to 2024 to have a functioning competency assurance program. Work towards this goal began shortly after the plan was approved. SCPP consulted with members, other regulators, and external experts, and engaged the services of an external expert consultant to develop the program further. The CAP Task Force, formerly a Competency Assurance Working Group, was formed to further guide the program development. Next, a Requirements Advisory Group was formed in 2024 and ultimately recommended the requirements we will discuss today. This group included pharmacists and pharmacy technicians in a variety of practice areas from across the province. The recommendations of this group were approved by Council in August of 2024. The SCPP's current strategic plan, starting in 2025, has a goal to complete the implementation of the Competency Assurance Program. For more information on the long history and many steps of consultation, see the Captivate section in most editions of the Scope newsletter starting in 2021, which includes an ongoing timeline to date. Members are also encouraged to continue to provide feedback through the link on the CAP web pages or by scanning this QR code. The requirements of the revised CAP that were approved by Council in August 2024 and initially announced in the October 2024 microscope will be to complete and document 2 CPD cycles annually, including 20 learning credits that can be a part of the CPD cycles or taken separately to the cycles. This will be slowly implemented over 5 years and will be documented directly into the CPD member portal. A CPD cycle can be thought of as one learning project recorded through each of the steps listed here. It includes assessing learning needs or practice needs, planning learning and setting a goal, learning what is needed, applying what is learned to practice, and evaluating the impact of the changes made. These steps do not always occur in order and are flexible to the circumstances. A CPD cycle can differ in size depending on the situation. A larger project and goal may include many hours of learning and could take months, while a smaller project may include less time spent learning and be fully complete within a week. It's important, though, to recognize that CPD cycles must include an assessment of practice, a goal, tracked application of that learning into practice, and an evaluation of impact. Additional information about completing all the steps of CPD is available on the SCPP website. Information to support CPD is available in the Competency Assurance Program web pages, which includes a brief introduction video about CPD, a CPD tool, a goal-setting guide, and more. Additionally, the microscope published in July included a breakdown of CPD steps along with examples of completing CPD in practice. Many pharmacy professionals are already doing some or all of the steps of CPD informally, depending on the circumstance. But completing each step purposefully and intentionally is important to maintaining and improving quality patient care. Evidence shows that when pharmacy professionals are educated and provided guiding tools about this process, they're able to complete each of these steps more confidently, and the impact on practice is increased. This is why SCPP's revised Competency Assurance Program intends to support and engage professionals in CPD. Not all learning that pharmacy professionals undertake will include the features of CPD. It is important to also take learning that is intended to identify what information you may not know you're missing and get updates on the newest treatments, even if you aren't sure whether they'll change your practice yet. Within the revised program, learning both within and separate from CPD cycles is valued and contributes towards meeting the learning credit requirement. A learning credit is a time-based unit of education. An activity accredited for 1 CEU is 1 learning credit, the same as you're used to, and 1 hour of non-accredited learning is also 1 learning credit, with preferred increments of 0.5 credits or half an hour of learning. This will be very familiar to most pharmacy professionals. It can still include all your preferred formats and sources of education, and continues to allow for you to self-select the learning that is most beneficial to you, whether it's part of a course or presentation, individual research, or sought-out discussions. There is no overall limit on the proportion of your learning for the year that comes from accredited versus non-accredited sources, but non-accredited learning is limited to 4 credits per learning activity, the same as in the current program. Larger projects may be broken up into multiple activities to ensure that the time spent learning is accurately assessed and can be credited. For more information on this, see the frequently asked questions on the CAP web pages. When you are assigning time to your learning, consider the time spent learning, not acting on that learning, for your learning credits. For example, you should count the time spent updating knowledge in preparation to precept a student, or updating your knowledge during their rotation, but not the full time working with the student. Similarly, consider the time spent researching to prepare for a presentation, but not the time spent presenting. Education that is part of a CPD cycle will be counted towards the learning credit requirement, as will any education that is done separately. So, the learning you document in the Learn step of a CPD cycle will count towards this requirement, as can learning activities that are done independently of your CPD cycles, regardless of the format of learning. This means the program still allows credit for convenient learning sessions that are intended to update your knowledge, but may not lead to direct application into practice yet. When activities are documented directly into the member portal, which will start as early as April 2025, it will automatically count the learning documented within CPD cycles and outside of CPD cycles towards the overall requirement without the need for dual documentation. Stay tuned for guidance on how to document using this tool once it's ready. As you can see on the framework for the Competency Assurance Program, the foundation of the program is continuing professional development. The other parts of the framework support CPD. For more information on the forthcoming intermittent coaching for practice improvement programs, see the CAP web pages. More information on verification is also upcoming. The timeline for these new requirements to come into effect is demonstrated here, with a slow rollout over multiple renewal cycles. Note that the learning timeframe is changing effective PD year 2026 as published in the December 2025 scope article. Going forward, education must be started and finished between July 1st and June 30th to be accepted towards program requirements. Education started as early as April 1st, 2025 will still be accepted for 2026 renewal. Program monitoring and evaluation will occur throughout this time and may change the requirements as needed. For 2026 renewal, the requirement remains to complete 15 learning credits, with the option to also submit a CPD cycle. As the learning dates are shifting, education completed starting in April 1st, 2025 will be accepted, and the education dates now extend to June 30th, 2026. Over the next 3 renewal cycles, submissions will be entered directly into the online CPD dashboard within the SCPP member portal. The CPD dashboard will be ready for members to begin entering education by July 1st, 2026, and information about how to use the CPD dashboard will be released prior to this date. Over these 3 years, requirements will slowly increase from 15 credits and 1 CPD cycle to 20 learning credits and 1 CPD cycle, and to 20 learning credits and 2 CPD cycles for 2029 renewal. As mentioned, program monitoring and evaluation will occur throughout this time and may lead to a change in the program requirements depending on the results of this monitoring. The annual topic requirements will remain the same and be based on a learning activity, so they do not have to be included in a CPD cycle. These topic requirements were introduced by Council in December 2022 and include a requirement for all practicing pharmacy professionals to complete learning focused on one of the concepts in the person-centered care framework, called the cultural safety requirement. For community pharmacy managers, there is also a requirement to complete learning that focuses on the pharmacy manager responsibilities. For both of these topics, the selection of the activity is self-directed by the member depending on what is most relevant for their individual learning needs and practice, and there are no minimums or maximums on the number of learning credits that must be taken on the topic. This should also be individualized to your needs. These topic requirements are still going to be based on a learning activity, which may be within a CPD cycle, if it aligns with the goal of that cycle, or may be a separate activity outside of a CPD cycle. You should make sure it is clear in your submission which activity is intended to meet these requirements. For 2026 renewal, the PDL includes a checkbox that allows you to identify the activity that meets this requirement. And the CPD dashboard will also include a feature to allow you to identify this within the activity documentation. The continuing cultural safety requirement means members must complete learning on one of the topics in the person-centered care framework pictured here. This includes such topics as harm reduction learning, equity, diversity, inclusion, and cultural safety learning, and Indigenous learning. The choice of topic within this framework is up to the individual member and should be targeted towards your individual learning needs. You can scan this QR code to get to a web page with the framework and a list of potential resources if you would like suggestions to get you started. This pharmacy manager annual education requirement applies to those listed as the pharmacy manager for a community pharmacy when they renew their individual pharmacist license. Similar to the cultural safety requirement, this requirement is left open to allow you to determine which manager responsibilities you will complete education on and how much time should be dedicated to this learning. We recommend looking at the manager responsibilities document to stimulate reflection on what could be improved or learned and to help guide the selection of an activity that aligns. This QR code will bring you to the pharmacy manager responsibilities document. Program monitoring will occur by the Competency Assurance Unit with direction from the Competency Assurance Committee and subject to the decisions of SCPP Council. The Competency Assurance Committee will be made up of pharmacy professionals as well as public representation. Throughout the rollout and continued monitoring of this program, information from various sources will be taken together to understand how effective it is, what supports are needed, and to inform changes to requirements and rollout timeline. This will include member feedback, updates to practice and scope of practice, results of the annual verification of member submissions, data from the complaints committee regarding any areas of focus needed, notes from field officers regarding what members need support with, and other sources of data that will be available in the future, such as results from the structured feedback programs. If you have any questions, please direct them to competency@saskpharm.ca, and you can provide your feedback and/or volunteer to be involved in future program direction by scanning this QR code or following the Provide Your Feedback link on the CAP webpage.